Welcome to Toledo Clinic TV. My guest for this segment is Dr. Naeem Lughmani, and he is a sleep specialist, something that we all can relate to and probably have had trouble with at some point in our lives, right? We're going to spend this segment talking about sleep apnea. It's a kind of a catch-all term. What exactly does it mean?
So obstructive sleep apnea is one of the most common sleep disorder that we see in our office. Basically, patients have, at night when they go to sleep, their airway collapses right behind the tongue. It collapses, and when it collapses, they can't get air in. And when the air does not go in, the oxygen level in the blood falls, and that creates a high stress environment in the body. The body produces stress hormones, and that results in heart rate to go fast, blood pressure to go up, and eventually their brain will lighten up. They break their sleep. And at that time, they start breathing again, and the stress hormones level go down, and everything is good until they go back to sleep again. So that process goes on and on and on at night. That causes significant sleep fragmentation, lack of oxygen, and high stress hormones, which is adrenaline, will cause high blood pressure temporarily, and eventually, if they keep doing it again and again for months and months and years, they develop that disease. Also, that they can have heart arrhythmias and cardiomyopathies and high risk of stroke because of this. So the main issue is lack of sleep and sleep deprivation, high stress hormones, and lack of oxygen that results in lots of sicknesses, diseases, and even mood disorders, sleepiness, accidents.
Is there an easy way to know if you might have sleep apnea, or does it require a sleep study to determine that?
So actually, you can get a good idea from history. If somebody is snoring, for example, or their spouses are observing that they are stopping breathing at night, sometimes they themselves feel that they're gasping or choking at night. Usually they're tired in the day. So once you have those symptoms, that's a good giveaway that they have sleep apnea. You, however, still have to do sleep study to confirm, partly because there is a certain level of sleep apnea that needs treated. If it is only few apneas, then you don't have to treat, and if it is moderate or severe, then you do have to treat. And also for insurance purposes, they need to know if you have sleep apnea or not, and you have to confirm it so that they can get treatment.
And a treatment would be like a CPAP machine, or is there anything else that can be done?
Yeah, there are CPAP treatment. CPAP therapy is the gold standard at this time. It works 99% of the time, except that the tolerance could be an issue for a number of patients. The way it works is that it gives breath under slight pressure, so that the airway, which was supposed to collapse, because when the brain sleeps, it's supposed to collapse. It can't do that because of air splint. The pressure will hold the airway open. So that resolves the issue. It's just that they have to get used to the mask, and it takes a little time, average 6 weeks, and then they do fine after that. So if people who are not able to tolerate CPAP, then there are other options. For example, there is a therapy called mandibular advancing device therapy. It's a dental device patients put in their mouth. It pulls the lower jaw forward, and that opens up the airway, and that's about 50% of the time it is effective. In some studies, it's even higher than that. And that helps. Typically, that's used in patients who are either mild or who have failed CPAP therapy. And then another thing is surgery. There are several surgical options available. The most commonly done surgery is called UPPP, uvulopalatopharyngoplasty, where our uvula and soft palate is removed, and the tonsillar pillars, the tonsils, where the tonsils sit, that area is also removed to try to open the airway. But the success of that is also about 41%.
That seems extreme.
Yeah, it's a lot of surgery for some success, but that is still used for those who can't use sleep apnea, who are not able to use dental device for some reason, and then this is what you can do. There are other surgical options too, which are somewhat more effective. Like there is a surgery called maxillomandibular advancement surgery, or MMA. They break the maxilla and mandible and move it forward, so that opens up the airway. So it's pretty aggressive. Very few patients do get it, but that's one option. Tracheostomy is another option, which is for very severe sleep apnea. where an opening is made in the trachea, and then the tube is placed. And then in the day, the tube is closed so they can breathe and speak normally, and at night they open the tube and the airway can open up. Also, it's quite extreme. If they are able to use CPAP, then there's no need to do that. The effectiveness of tracheostomy is very good. It's almost 100%. But very few people opt for it.
Yeah, I can understand why. That does seem like an extreme measure. Now, who is most likely to suffer from sleep apnea?
So sleep apnea, there are risk factors. One of the most commonly known is obesity. If you, the more we gain weight, the less airway size is, and that it collapses easily. So that's one of the most common. However, you don't have to be obese. 30% of patients of sleep apnea that we diagnose are not obese. The other risk factors are jaw abnormalities. Some people have smaller lower jaw. Some people have lower jaw, which is not small, but it's just placed back, so that moves the tongue back, and thus there's less space in the throat. We call it micrognathia, which means small jaw, and retrognathia, which means it's a retro-placed jaw, and that is also a risk factor. Then there are certain diseases. It's very common, sleep apnea, for example, patients with heart disease, coronary artery disease, patients with congestive heart failure, very common. Almost half of those, or actually more than half of those patients have sleep apnea. Patients with hypertension, you should look for sleep apnea. Type 2 diabetes. So these are some of the common risk factors. Some other ones are pregnancy, partly because of weight gain, and you have more likelihood of sleep apnea. Renal failure patients have sleep apnea issues as well. So there are a lot of risk factors for it.
And so aside from the fact that you walk around in a daze because you're so sleepy, there really are reasons that you ought to get it checked out and treated. Yes.
Cardiovascular, as I said, heart disease, it can cause heart disease. Actually, the most scary thing is that people who have sleep apnea untreated, they have 2 to 3-fold higher risk of dying compared to those who don't have it, according to the data. But they also have, higher risk of heart disease, arrhythmias, stroke, and mood disorder, motor vehicle crashes. People with sleep apnea have 7-fold higher risk of deadly crashes. Wow. That's why DOT, DOT examination, they always talk about that. And you need to, if you are obese or you have risk factors for sleep apnea. Neck size is another one. If it's large neck size, more than 17 in men and more than 16 in women, you are highly likely to have, more likely to have sleep apnea. So when they go for CDL license and go to DOT physical, so that they ask them that. And if that they fulfill those criteria, they come and get the study done, just because of the fact that they are more likely to get in an accident.
So if you suspect it, it's really as simple as just coming in and speaking with you and going from there to get the diagnosis.
Yeah, it's very easy. Consultation, and then sleep studies. First study is to see if you have sleep apnea, and the second study is to treat. There are options to do home studies now for sleep apnea. If somebody is really high risk for sleep apnea and we think that most likely than not they have it, one can do a home sleep test as well. And then one can also do, there is a special CPAP machines now. You can actually do it without the studies, called auto CPAP devices. So that can be also utilized in these patients who are at high risk of sleep apnea.
Okay, very good. Thank you so much for all that important information.
You're welcome.
And we will be right back.